Hi, my name's Emma Knights and I'm the Contract Manager for LIMHS. LIMHS is a low-intensity mental health service that was implemented on the 1st of July of this year. It's a fantastic new service and I'm really proud to be a part of it. And I do have a team that is dispersed across regional Victoria.
Hey guys, my name is Michaela Howe and I am one of the case managers with genU's low-intensity mental health service. So I service the Ballarat, Goldfields, Wimmera, Grampians regions. So a lot of towns that come in under that, but really that just sort of incorporates some days in Ballarat and then some in Horsham, and then a little bit of a mix of telehealth all around the region and Zoom, one-to-one, face-to-face sessions. It really just depends on what works for the client and how we can best help them. I guess a typical day in the life for me is the fun admin stuff, working through, who I need to reach out to for clients, what's coming up for clients, and how I can best help them that day, working through what's coming up that day, and then jumping on calls with clients and working through, I guess, what they need, what's going to best support them, whether that's just a listening ear or whether I need to look elsewhere for something to help them out. And yeah, just figuring out the best way to help start moving them towards their goals, I guess.
Hi, I'm Chris Sherwell and I'm the new Low Intensity Mental Health Services Case Manager for the Western Victorian South Coast region, which includes the Glenelg, Moynes, Southern Grampians and Corangamite Shires. My background is in community services, complex case management, family violence and emergency crisis support.
Hello, my name's Anne-Marie Stewart and my role is as Administration Officer with LIMHS genU service. I'm based at home and at the Belmont office.
Look, I see LIMHS to be very important right now. I think with all the stresses that people are having in their life through COVID and what that brings, lockdowns, homeschooling. We know how difficult homeschooling, is for parents. It's challenging. And I think too, just adjusting to these new ways of living is really hard. Not being able to see your friends or family. And I think it's never been more important right now to have a service that is looking out for regional Victoria. We understand as well that mental health problems are more common. And we can see the effects that it is having. It really does interfere with how a person thinks, feels and behaves. And we recognise as well that, people are busier and more stressed right now. They don't have the time, nor do they have the finances to be able to see a service professional and be on this waiting list. With LIMHS though, we don't have a waiting list. Our service is free. We provide a step care approach that supports people to take greater responsibility for their own mental and physical well-being. You can access our service by phoning our lovely admin person, Anne-Marie, or refer yourself via Facebook, a website, or even send us an email. We're here. We want to support you through this difficult time.
So the low intensity mental health service uses a range of evidence-based practices. So I guess we use an eclectic approach to practice then, which basically just means that we draw from different approaches and take strategies and strengths from different approaches rather than sticking with one. So whether that's cognitive behavior therapy or solution-focused therapy or acceptance and commitment therapy, just to name a couple. We sort of pick and choose based on each unique client what we think will hopefully help them. And I guess just the heart of that and like the central theme is that we use a person-centered approach to practice. So that just means that we think the client is the expert in their own life. We think that they have the resources to move towards their key goals, and we're really just here as a guide and a support to help them, gain a little bit of insight, get access to some resources that they might not have heard of or might not know how to access, and just be that listening ear, an unbiased, non-judgmental ear that someone can come and talk to, and we'll just be there in whatever way we can to help them move in that right direction.
LIMHS is different because you don't need a referral from a GP, the NDIS, or a care plan. You can access our service quickly and easily, and it's free. There is up to 8 sessions of intervention available with a range of service delivery options to meet everyone's needs. And these include face-to-face, telehealth, digital interventions, and group sessions.
We connect with clients in rural and remote areas, reaching out to people that are homeless, have social phobias, or are isolated. We use evidence-based interventions, which, engaging the clients and using their guidance, we can assist to a better health and wellbeing. This service will allow us to support more people across Western Victoria and to live better lives with mental health. The referral is very easy. Clients can self-refer. A GP, a carer, an advocate or a support worker can also refer. Just visit the genU website and scroll down to new mental health services in Western Victoria. Click on the link or call 1300 558 368 for our friendly staff's guidance.